What's up, everybody? Welcome to this week's episode of the Well Man's Podcast. My name is Brian Brosi. I'm joined by my friend and co-host Keoni Tita. Keoni, how are you today?
Good. Thanks, everybody, for listening once again.
Yes.
Hopefully this information that we are sharing helps you stay healthy, be well, keeps your family and friends healthy and well. And this topic that we're talking about today, I've seen a lot of throughout my career right now as a primary care physician, and it's on skin cancer.
Yeah, I'm looking forward to reviewing this because I see the skin quite a bit. I kind of forgot all my regular borders or my things to look out for, so I'm looking forward to it.
Yeah, it's important because as we know, like, some of this is really insidious, and things that may appear benign on your skin may not be, and so on and so on. So I'm hoping that our talk today will allow people to kind of get an idea of what to look for, how to treat, how to prevent, and so on and so on. The nice thing about it is skin cancer is one of the most common types of cancer. Kind of makes sense when you think about skin being the largest organ. And then fortunately, it's also the most treatable, especially if it's caught early. So that's great. Affects about 3.5 million people in the United States. There does seem to be a correlation that the closer you are to the equator and the fairer your skin, and of course, the more sun exposure you have, the more likely you're gonna have skin cancer. So that tells you a little bit about some things that you could do to help prevent it. Anyway, it is one of the cancers, unlike most others, that is steadily increasing, and a lot of that has to do with like sun exposure and just not being aware of what, or I shouldn't say not being aware. I mean, I think most of us know that the sun is not good, not great for your skin, especially if you're getting burned quite a bit or out there too long.
Right.
It's not to say that the sun is bad. I mean, again, a little bit of sun on your skin goes a long way towards health. You just don't want to get burned. Is the main thing. Let's see. One of the main things I think is good about this, or I think the reason why it's steadily increasing, is because we're maybe better at screening for this, and doctors are looking on your skin. I think if you're going to go see your primary care physician, this is one of the things for a physical exam they should do all the time. Just take a look at the skin, at places where you don't really see, on your back, wherever. And it doesn't necessarily have to be sun exposed areas, it could be, and this is kind of doesn't make a whole lot of sense for some people. When you think about, well, if the sunlight's the cause, then most cancers are going to be in the sunlight exposed areas, and that is true, but also they can appear in areas that aren't really exposed to sunlight, like on the bottoms of your feet, or at your waistline and things like that. So it's good to just have a physician just check you all over, and I recommend that you do this once a year. Now, the thing about it is, this is especially important the older you get. It's also especially important if, like me, when I was younger, and maybe you can remember this too, Brian, but I mean, I remember getting burned a number of times. Like every summer I got burned, just about at the beginning of the summer, and that's a big, that's kind of increases your risk significantly. The more burns you have, the more likely you're going to have some type of, skin issue, skin cancer.
Right.
But,
all the more reason, I think we definitely did an episode on like sun exposure and kind of natural sunscreen.
Yeah. Look up, and this is a good follow-up podcast to that. The reason I think this podcast is especially important, and as I stated before, I've had patients who let some things go and don't think much about it. And the earlier you catch any type of skin cancer, the easier it is to treat, the less likely it's going to appear, the less likely it's going to, be devastating.
Right. So even more so than just, your annual checkup, just having your significant other or you trying to even if you know you have a mole or a spot or a birthmark or whatever the case may be, kind of monitoring that for any changes or some of the things I'm sure we're about to talk about that kind of give off the telltale signs.
That's exactly right. Yep. So yeah, doing self-examinations, having, significant others or loved ones looking at your skin, and
just monitor,
which it's huge. So there are different types of skin cancers. The most common ones are basal cell carcinoma, and that occurs mostly on the head and the neck. Again, sun exposed areas. And the name basal cell carcinoma gives you an idea of where the cancer kind of comes from, and we'll talk about that in a little bit. And then there's squamous cell carcinoma, tends to be found on like the backs of hands and forearms, head and neck, again, sun exposed areas. And those tend to be, certainly less benign relative to melanoma, which is the most, another one that falls in that group as being the most common. So melanoma. And the melanoma thing, we'll talk about this a little bit, but this is probably what me and you both learned in medical school, Brian, is, the ABCDE guide. You basically, A is for, well, keep an eye on it. Is it asymmetrical in shape? That may give you a clue that it may be cancerous. And we're speaking specifically of, melanoma.
Which melanoma, correct me if I'm wrong, Keoni, just being a fancy word for skin cancer.
Well, yes, it is a fancy word for skin cancer, but again, the name kind of gives you an idea of where it's coming from. So you can think of melanoma, melanocytes, that reside in the skin, that type of thing.
Right.
So so there's some method to the madness here, so to speak, with the naming. So
yeah, absolutely. Just for the layman and just kind of in general.
Yeah. I mean, some of these names sound, if you're a layman, you just, they sound like completely foreign, but it does give you some idea of where they're coming from. And if you know about the anatomy of skin, and we'll talk about that in just a little bit, you get an idea. So A is for asymmetrical shape, B is for borders that are irregular, so you look at the lesion, whatever lesion that one may be, are the borders irregular around that lesion? The color, is the color the same throughout, or is it not the same all over? Not the same all over gives you an idea that it may be something for your doctor to look at. If the diameter is larger than a pencil eraser, most moles are much smaller than that. That may give you an indication. I think one of the biggest indications, though, is it evolving in shape, size, and color? Is it changing?
Yeah.
So
that really speaks to what we were saying earlier about just really monitoring these things. You don't necessarily, knowing these ABCDEs are great, but honestly, just kind of monitoring your typical things or what you do or don't have, and seeing if there are any changes. And if there are any changes, it's a good sign to go get it checked out.
Right. Exactly. It's so that melanoma is by far the most dangerous type of skin cancer. It accounts for only 4% of all skin cancer diagnoses, but it's responsible for 80% of skin related cancer deaths. So it's a biggie. The non-melanoma skin cancers, squamous cell, basal cell, they're the majority of the diagnoses. With those, 80% are basal cell, 20% are squamous cell. And then all the other diagnoses, I'll briefly touch on them in a minute, of other types of skin cancers, is like usually less than 1%. So being Caucasian or having lighter skin, you're definitely more at risk for somebody who has darker skin, right? So darker skin really helps. And you see this with humans, right? The closer you are to the equator, the closer your heritage is to the equator, the darker your skin, the less likely, the more protection you have from the sun. So it's especially important. So people with fair skin definitely protect themselves as much as they can, especially if you're going to be out in, sun exposed areas, or live near sunny areas like you, Brian, right? In sunny Florida. Right?
Eat my lycopene.
That's right. So it's like, melanoma of the skin, 1 in 35 among men and 1 in 54 among women. It is definitely more prevalent in men than women. And we don't really know why that is, but definitely more prevalent.
Maybe hard-headedness.
Yeah, it could, could be. So melanoma is the most dangerous. Squamous cell, I would probably say, is after that. It just has a greater capacity to metastasize compared to basal cell. Genetics does play a little bit of a role, but the predominant catalyst for getting cancer, skin cancer, is exposure to ultraviolet radiation or sunlight, especially UVB, B for bad.
Okay.
So that's the most important thing for primarily. How much exposure did you have early on in your life?
Mm-hmm.
And it's certainly one of these things where I hate to harp on it because I don't want people to go away saying, oh, Keoni and Brian are saying the sun is bad. That we're not saying that at all. I am saying though that if you get overexposure, it can be very problematic, and a lot of people don't realize they're getting overexposure a lot of times, right? So this is why some of the recommendations out there, we talked about this in our podcast, is put on sunscreen, especially if you're going to go hiking or whatever. Use wear long sleeve shirts, wear a large brim hat, especially if you are one of these people where you work outdoors all the time. I have a landscaping client, a couple of them who, this is a big deal we talk about, and the issue for them is finding clothes that actually breathe, because it can get so hot. And there's actually certain clothes that actually allow you to breathe, that are built for that also have UV protection on them, in them, and allow you to breathe. So that's something people can look up online.
Yeah. Now, obviously, Keoni, sunburn, we know we got too much exposure. Are there any other ways that I may know that I'm having too much exposure?
Yes, there are. And it's a great question. One very good thing to do, I think, especially if you may have really fair skin, is you can actually go, this is pretty cool. You can actually go to the, I think it's a national weather website. And there you can actually see what the UV index is for your area. And it will give you an idea, and it gives you daily updates on like the cloudiness and all that stuff. And it will, it's color coded. So one color, I think like green for good or whatever, is like where you can go outside. You probably don't need to use a whole lot of sunscreen, but if it's really hot out and the sun is really shining, then you could. That's one way to help and to get an idea of what's going on. Yes. So the cloudier the day, the less likely you're going to get, sunburn. But let me tell you, I've been out on cloudy days. You're out at the beach, windy, you don't feel it on your skin, and you can get sunburn really bad. So it's really the dose, the duration plays a big role.
Yeah. And then, so just kind of branching off the duration, what duration do you feel like is okay to have, unprotected? So just an example, I just sat out on my front porch, baked in the sun, 15 minutes for this podcast.
Yeah.
Completely naked, by the way.
Yeah. Really right.
It in. Nothing on. No sunscreen, no nothing.
Getting your vitamin D.
Yes. So how long? Because I think that's a really integral part of kind of a daily activity. It's getting those 10, 15, 20 minutes max, in my opinion. Do you?
I agree. It's good to get out and get some sunlight on your skin. But the duration really depends on how fair your skin is. So on a really, and the time of day when you're doing it. So somebody who's very fair skinned, between usually 10 in the morning and 2 in the afternoon, is like where the sun is giving out the most UVB and can burn you the most. I mean, for somebody who's really fair skinned, maybe 15 minutes is too much.
Okay.
At that time of day. So it depends on the time of day. Depends on your, how fair skinned you are or dark skinned you are. You have to play by ear. But if your skin is getting to the place where it's starting to feel hot and you touch it and you're starting to see a little red mark there, it's time to get out.
Okay.
You know. But yeah, you really do have to play that by ear. You know, and you brought up something else. You know, a lot of people don't realize, and we talked about this on the last podcast, that, you know, there is such thing as internal sunscreen, and, you know, lycopene being one of them. Eating a diet high in fruits and vegetables actually helps protect your skin, not only from the harmful effects of UVB radiation, but it, you know, when they do studies on this, and even with some supplements, we'll talk about it. You see that you can stay out based on your diet. If you have a very poor diet, you will burn quicker than if you have a really good diet. Yeah. Especially a diet high in vegetables and antioxidants, fruits and vegetables, you don't burn as quickly. So, and not only that, a lot of those compounds in those plants actually help slow the progress of cancer or help prevent it. And in some, especially combined with some conventional treatments, can help treat it. So I tell people, like, think about the topical, you know, kind of sunscreen, but also think about the most important is the internal type sunscreen, eating the colorful, you know, eating the rainbow and foods high in antioxidants. Yeah.
Just doing those lifestyle things we always talk about.
Yeah. You know, so I don't want to, especially if you have darker skin, you know, you're of African descent or from the equator somewhere, your ancestry. I certainly don't want to come off and saying that people that have an ancestry that tend to have darker skin are immune to skin cancer. That is not true at all. Okay, but your risk is significantly decreased, especially compared to people of fair skin. So yeah, so people of Caucasian descent really do need to, you know, be careful with it.
Those poor Irish.
Yeah. Well, you know, it makes sense too. I mean, you think about Ireland, you think about, you know, England and stuff. You know, those are cloudy areas of the world typically, and so, you know, you just don't have the melanin in your skin that people from, you know, equatorial areas do.
Yeah, absolutely.
Let's see here. So I want to just, I don't want to get caught up into the details, because I know people, you know, I don't want people just being like falling asleep here and thinking that we're just, you know, running through, you know, a med school class here. But let's just go over a little bit of the anatomy of the skin. And I don't really want to get into too much detail, but so the skin basically has two distinct layers. One is the epidermis, right? And that's the self-renewing protective layer. That's the layer basically at the outermost that you can see, okay? And then underneath that, you have what's called the dermis, and that's mostly like fibrous connective tissue. That's where the skin's vasculature is. That's where the nerves and hair follicles are, and your glands. The epidermis is mostly made of keratinocytes, and it's a cell type that's formed deep within the epidermis at what's called the basal layer. So remember we said basal cell carcinoma, gives you an idea where that's coming from. But anyway, the basal layer, these precursor cells, also known as stem cells, they actively divide and they produce keratinocytes, and they're pushed up to the surface of the skin as new cells are created, and basically you shed and slough them off as you go. That's constantly happening as you know, age. Yeah. And as they migrate up towards the skin, they become squamous or flat. So hence squamous cell carcinoma. Now you're getting an idea of where some of these things are coming from. Yeah. Right. And you know,
also see why the irregular border and kind of the evolving nature of it is starting to come into play.
Right. Right. And these as they migrate up from the basal layer, you know, they're basically being constantly pushed up and replaced by new cells. And also within that epidermis, there are pigmented cells called melanocytes, hence what are we talking about there? So now you get the idea of melanoma, right? And also in that layer, you get some immune cells and some sensory cells called Merkel cells. But anyway, since your skin is constantly exposed to the environment, right? It is susceptible to all types of damage, and especially damage from UVB radiation. And that is the predominant causative factor, you know, the main catalyst for healthy cells becoming cancerous or malignant. And the other thing that what's really happened when you are exposed to a lot of sunlight or to UVB radiation where you get burned, the immune cells in your skin just basically get sick. They don't work as well. So if they see cancerous activity happening somewhere in the skin and they're sick, they're not going to be able to stop it. You know, they're not going to be able to cause that cell or to cause apoptosis or to get rid of that cell. And that cell can then, you know, multiply and, you know, create some of these carcinomas that we're talking about here. And a lot of times what it does is this UVB radiation affects, you know, basically at the genetic level, the cellular, if you will, integrity of keeping everything homeostatic, right? So you've heard, I'm sure people have heard of like the P53 mutations. You know, P53 mutations are basically, you know, genes in your DNA that help suppress tumor formation, but usually UVB just knocks these things out where it can no longer suppress it as well, right? Wow. So, also the other thing, this will give you people an idea of, well, gives you an idea of natural therapeutics and also of how to maybe prevent cancer from beginning, skin cancer from beginning in the first place. All right. And what I mean by that is when you are overexposed to UVB radiation, you get an overactivation of what's called COX-2 enzyme, right? And there's a lot of drugs out there. It's called cyclooxygenase 2 or COX-2. And this enzyme, if it's overactivated, it just leads to chronic inflammation, and chronic inflammation leads to cancer, and it's a driving force behind skin cancer. Well, there's one supplement out there that I kind of recommend to everybody, unless you have an allergy to fish. If you do, we can switch you to something else, is fish oil. Fish oil actually will suppress overactivation of this COX-2 enzyme. So that's one reason, one good thing about fish oil. Another thing that will, and maybe you've heard of this, Brian, is in, I've read a couple articles about it years back, but anyway, there's been research out there, it's been in the media, that aspirin, right? Aspirin may help prevent cancer formation, especially skin cancer. And one of the reasons why is because it's an inhibitor of this COX-2 enzyme also. So a daily aspirin, besides being a possible cardiovascular benefit, I mean, it has lots of negative side effects that may not warrant using it as a cardiovascular preventive, but it also has some other things that, like this, where it can help prevent skin cancer. So aspirin is one of those things that may do it. But why not just take fish oil? I recommend that across the board to my patients. You know, if you don't have an allergy to fish or anything like that, it's a good thing to do. If you do, then you can get plant-based omega-3s.
Okay.
Yeah. So we know, so going back, so as the name implies, melanocytes, melanoma results from the malignancy of pigmented melanocytes that reside deep in the epidermis. Okay, so that's where that comes from. And basal cell carcinomas, basically you're talking about the stem cells at the basal layer of the epidermis, you know, becoming cancerous.
Mm-hmm.
And then squamous cell is, you know, originates at the keratinocytes, and they're at the superficial layer of the epidermis, not the basal layer. So now there are other types of cancers that I'm just going to mention, but they're not they're really rare. So you have the Merkel cell carcinoma, sebaceous carcinoma, atypical fibroxanthoma, microcystic adnexal carcinoma. These things also are types of skin cancer, but they're usually not, they're rare compared to the others. So I just don't want to spend a lot of time on that. I think we'll put people to sleep on that one.
Yeah, absolutely. And so as far as, we've got our ABCDEs. As far as diagnosis, I assume they're going to do a biopsy. Is there anything else that goes into, you walk into the doctor and they're going to decide if this is or isn't skin cancer?
Yeah, there's a lot more than doing your A, B, C, D, and E. And that A, B, C, D, E type thing really applies more to melanoma than to the other types of skin cancer. Yeah, we'll definitely get into that. I want to talk about it because I think it's gonna help people just kind of prevent this from happening. Let's see. We said melanoma and non-melanoma skin cancers are more common in men than women. That's interesting. Lighter hair color is associated with an increased risk of basal cell carcinoma. Another thing interesting, lighter hair color usually goes along with lighter skin color, not always, but can. There are knowing your skin phototype may be helpful for people. There you can kind of get to, there's online you can match your skin to its certain phototype and you can get a better idea of how fair skinned you are and so on and so on. I think it's a good thing to look at online and just see where you are, and they can give you an idea of sun exposure, some of these sites.
And so how does someone find that, Keoni? And remind us what a phototype is.
So your skin phototype is just basically, think about it as the color of your skin. And you can go online and just look at just type in, it's almost like you're looking at a palette.
Okay, so you're kind of matching.
Yeah, you're kind of matching your skin to, that type of thing. Yeah. It also, the other thing, I think this is really important that people should really know, because a lot of people don't realize that there are concurrent skin conditions that can increase your risk of certain skin cancers, especially squamous cell carcinoma. And one of them is actinic conjunctivitis. And this is interesting. People may not know, but this one is kind of a condition. You can look it up, but it's basically your conjunctiva in your eye. So think about the whites of your eye being kind of almost like bloodshot from light exposure. Okay, so all light is radiation, right? And even light like are they called Klieg lights, that like if you're looking at a light show or whatever, like if you have exposure to that can cause some damage. I think if you're in like cinematography, lighting like that, and photography, being exposed, long exposure to very strong light can increase this actinic conjunctivitis, which then can increase your risk of squamous cell carcinoma. I don't even know if I can say this word, but I can. It's called poikilderma of Savat. This strange sounding name is more normal than you can probably see this on a lot of people. Anyway, what it looks like is in the neck area and facial area where the skin becomes like more ruddy complected. It just ruddiness, it looks red. Doesn't have a nice skin tone to it, maybe a little bit rougher. It's usually associated with aging, but also sun exposure, and that also increases your risk. And then we've heard of, they always call these benign, like the facial actinic keratosis. These are like the stereotypical age spots or whatever people see, and they're like, oh, don't worry about it, it's benign. But it also, if you have a lot of these and you see these in a lot of older people, it increases your risk of cancer. One of the things that people think is benign, which is really isn't, is the number of freckles you may have on your skin, right? So somebody who's really freckled a lot also has increased exposure. And then also with somebody with a lot of moles also, it can increase your exposure to, your risk also.
Mm-hmm.
Smoking, of course, right?
Mm-hmm.
10 cigarettes a day almost triples squamous cell carcinoma in one study. And then anything that you're doing that suppresses your immune system, right? So we already talked about UVB suppressing your immune system, but what about going through chemotherapy? What about just being overrun in general, not getting enough sleep? Anything that suppresses your immune system, but more frequently we see this in people like organ transplant, people going through organ transplants or going through chemotherapy. It's a whopping 65-fold increase of certain carcinomas compared with the general population. That's crazy. And it's something to think about with your patients. So it's like, so it makes me think, right, as a healthcare provider, if somebody's going through this, to really across the board, be careful with your recommendations of, well, maybe you should go out and, get your 15-20 minutes of sunlight and so on and so on. Maybe it'd be better to do that after you're done with treatment.
Sure. Yeah.
Let's see what else. Okay, so you were asking about diagnosis, and typically a lot of skin cancers, I mean, if you're really doing what we talked about at the beginning and focusing on looking at your skin, at least doing it once a year, having a physician do that, you can really prevent some of these things. Because again, like we said, having a diagnosis of even melanoma, if you catch it early, it's highly treatable, and especially with squamous cell and basal cell.
Right.
But so basically, usually it's diagnosed or brought in. It's diagnosed on patient history, physical exam primarily, and there's a variety of diagnostic techniques. But typically, if you find something that looks like a suspect lesion, you biopsy it. You take a sample of the tissue, and you just look and see if there's malignancy by histological staining and looking at it under a microscope. There's something that dermatologists can use called dermascopy, and this is it's like a magnifying device that examines the skin. It basically allows the doc to look kind of below the surface of the skin, and more so than what can be seen by the naked eye, and it gives you better accuracy in diagnosing like carcinomas. There's something called lymph node mapping and biopsy. It's basically like a kind of imaging technique to see where, if it is cancerous, if it's spreading or malignant, and what lymph nodes it has gone to. Usually imaging tests, you really don't worry about these so much unless, it looks like this is spread. So you're talking about computed tomography or CT scans, positron emission tomography. This is the PET scan. The PET scan is basically you give the person or radioactive glucose, see where the glucose concentrates. It tells you where the cancer is localized. Right. Simple chest X-rays can tell you if it's metastasized to the lungs. And then you can use MRI scans to see if anything's, metastasized to the brain or the spinal cord. So those are just some of the things that doctors will use. There are other things, novel imaging techniques out there, like called multispectral imaging, and it's basically a imaging technique that is specific for melanomas. It has a very good sensitivity to detect melanomas, but it has a low specificity, meaning that you can get a lot of false positives on it, right? So, but it's still a good test. Blood tests can help somewhat. I mean, I run blood tests all the time. You're just not gonna diagnose skin cancer off a blood test, though, but you may get an idea if it's spread. Like sometimes lactate dehydrogenase in the blood panel is elevated in people with melanoma, and sometimes a complete blood count and liver function tests can be part of a skin cancer workup, but it's certainly not going to be part of the the main thing you use to diagnose it. There's this whole thing with cancer, with how you stage cancer, and each type of cancer has its own staging technique. Basically, without getting into the details, you stage the cancer. You want to see basically, is it localized? Has it spread? What areas has it spread to? How many lymph nodes are there? Has it spread to organs? And you get a classification on this. And the higher the classification, it goes from stage 0 to 4. The higher the classification, the worse prognosis. The lower the classification, the better the prognosis.
Yeah.
So that, and it seems like every cancer has their own type of staging technique. The most common type of staging technique, it's basically called the TNM system. So just leave it at that. But people can look up that. I bring that up because a lot of people have asked me, what does this mean on a path report? And so we go over that, just talk to them about what the staging actually means.
Yeah.
So, all right. So let's say, all right, so we have our diagnosis. We have our diagnosis of cancer. Let's say it's, melanoma, or maybe it's a non-melanoma type skin cancer, but what do you do then?
Right.
So depending on how invasive it is and the staging, you can do an ED&C, which is an electrodesiccation and curettage. And basically all that means is, you're basically using a device to kind of burn the cancer away and to get it into normal tissue margins where, you want to just make sure you got the whole cancer. The curettage is like kind of like using a scraping technique where the electrodesiccation is using like electricity, a heated electricity to burn away the skin cancer. There's also cryo, and that's kind of more common than this other one, cryosurgery, that at least from what I've seen with my patients. And cryosurgery is just using, liquid nitrogen, which can, lowers the tissue temperature down to like minus 50 degrees Celsius and just, burns it, freezes it to death, burns it off. And it's certainly not suitable for invasive cancers or aggressive tumors, especially ones with ill-defined borders. Same thing with the ED&C. So if you have good defined borders, and the staging is, tends to be low, then you may want to use these. And then the next thing is surgical excision. This one, it's tricky. You may want to do surgical excision if the tumor is in the area that is not really seen. If these are on sun exposed areas, which tend to be your face and neck and stuff, a lot of times you want to make sure that you're really precise with how you cut out these lesions, right? So there's something that I always recommend to my patients, especially when we're dealing with this, called Mohs Microsurgery, and Mohs, M-O-H-S. It's named after some famous cancer researcher. And basically it's a microsurgery technique that really limits the scarring and is very precise in getting the cancerous margins out and keeping the healthy tissue there. So it leaves small wounds, and especially if you have it in areas that you show to the world, like your face, this is really the way to go. And I tell my patients, just try to find a doctor who is kind of certified in the surgery, because not all dermatologists are. So you want to kind of ask about that.
And what's it called one more time?
It's called Mohs Microsurgery. So M-O-H-S. You could just look it up. It's actually the preferred method for all non-melanoma high-risk tumors.
Okay.
Yep. And then of course radiation or radiotherapy. Again, now we're getting into some of the treatments where the staging is getting higher. So radiation may be considered there. A lot of people don't even need to do any of this cut and burning type stuff, right? So I've had a lot of my patients who just basically did what we call superficial therapies, where they're using topicals. These are, maybe immunomodulating agents, just topical creams or whatever that can kind of get rid of the precancerous or a cancerous lesion that has very, very low staging. So if you catch it early enough, the
Right.
topicals are the way to go.
Now, are these, I imagine these are topicals you get prescribed, right?
Yeah,
Yeah.
yeah,
These are
yeah,
strong
yeah,
topicals.
yeah. I mean, usually dermatologists will prescribe them to you. So there's a number of them, but that's the way to go if you catch it early enough.
Yeah, absolutely. All the more reason to know your ABCDEs.
Right. That's right. There's other therapies out there that are kind of emerging, and there's some drugs out there that just attack the cancer at different pathways within the cancer. So, for example, there's this something called, the name is kind of funny, but it's called Hedgehog signaling pathway, which is it's basically it's basically a signaling pathway that helps regulate the growth of stem cells and make sure they're doing their proper growth. And any dysregulation of that is going to lead to aggressive types of cancers and promote metastasis. So there's drugs that kind of attack that. So this is where you maybe have higher stage. You may want to think about using some of these treatments. I can't think if I've had any patients use this off the top of my head, but anyway, this drug seems to be pretty cool because it significantly in the studies decreased like the recurrence of new tumors and significantly reduced the size of existing tumors. There's laser therapy. Basically it's using a laser to where you can really pinpoint the tumor and kind of burn it away. There's also what we call immunotherapies, where basically using this therapy to kind of stimulate your own immune system to find the cancer. So immunotherapies, interferon alpha. There's what else? Oh, there's another one. There's another anti-tumor therapy that I want to bring up because it's basically extracted from the sap of a plant, and it's called ingenol metbutate picado. And this is a topical anti-tumor therapy. I think the plant is called, Euphorbia p+. It's a plant traditionally used as treatment for skin diseases, and it is FDA approved for actinic keratinosis, precancerous lesion, and any UV induced precancerous lesions. So this is a good topical treatment for non-melanoma skin cancers. One of the things that we talked about a lot, I think we talked about it when we talked about cancer, but we certainly talked about it with diabetes, is metformin.
Yeah.
And metformin is a oral hypoglycemic agent. It's one of my favorite prescription drugs out there. And again, in the media, you've heard of, may or may not have, but there's been a lot of information out there on metformin being possessing like tumor suppressing, has a strong tumor suppressing effect. And there's a number of ways this works. One of the ways, kind of the indirect way, is it helps with sugar handling in your body.
Right.
And the lower your sugar levels are in your blood, the less likely you're going to be inflamed, the less likely you're going to have tumor growth, the less likely insulin is going to be high. Insulin acts like a fertilizer for tumor growth. So the low, you want to make sure that is low. It's also one of these things where it actually helps reduce the activity of pro-inflammatory pathways, metabolic pathways. And this is one of the main reasons it seems to inhibit the growth of human melanoma cells. It's not a primary treatment, but it is one of those treatments that can certainly help. And I think that based on what we know with this drug, it's almost like this drug should be recommended, kind of like what 20 years ago doctors were recommending aspirin. Maybe most people should be on low dose metformin, whether or not they have diabetes, because of all the benefit that it can give, and has a very, very powerful also longevity effect too.
Right.
So
Yeah.
I mean, it's not without side effects though.
Yeah, I know we talked about that in detail in our
Right.
diabetes
Yeah.
series.
Usually Right. Usually the side effects are like digestive stuff, and sometimes it's transitory, sometimes it's not. I have some patients who can't tolerate it. So, all right. So that's kind of, I guess, from the conventional standpoint, how we kind of look at that. Let's just go into quickly here, because I know we're running out of time. The lifestyle considerations and some nutraceutical considerations.
All right.
All right, we talked about skin self-examination. I don't want to beat that around anymore, but ABCD rule, that's important, especially with melanoma, which is the most aggressive type. Reduce UV exposure. This is specifically UVB. So we're talking about light exposure. Think about tanning beds. UVB. It's the UVB radiation, the one that we really want to be careful with. Tannin beds are not benign, so you want to just make sure that you're minimizing your exposure there. Think about internal sunscreen. Foods very high in antioxidants, lots of color. Spices are very high in antioxidants, clove, cocoa, your vegetables, curcumin, turmeric, what else? Celery, lycopene from tomatoes, just the colors of the rainbow.
Yeah.
And now let's go into nutrients. All right, so again, a multivitamin. I mean, really, people should really be taking a multivitamin. I don't know why. I mean, this is really a pet peeve of mine, Brian. I don't know why every so often I get online and I see an article that says, multivitamins are a waste of money and you're just peeing them out,
Yeah.
I mean, maybe that's true if you're taking Centrum. It's not a great thing to take, but I mean, when you look at the nutritional research and how to maintain your immunity and so on, just taking a good multivitamin on a somewhat regular basis goes a long way into keeping you from suffering in many ways. And it's, and it's not, for the most part, it's not going to hurt you.
Yeah.
So anyway, B vitamins, which are found in multivitamins. So here, animal study, niacin, B3, lowered the incidence of UVB induced skin tumor formation in a dose-dependent manner. All right, so basically, the more B vitamins you have, the lower incidence of UVB, the lower incidence you have of skin cancer, at least in these animal studies. And I think, and we're talking about both oral and topical. Okay, so we're talking about both of those. So, and there's another study. There's a review of 15 studies of folate consumption and cancer risk. Higher folate consumption, think of foliage, right? The green leafies, was linked to an overall risk reduction in the incidence of melanoma. I mean, that's great. 53% over 3 trials, which is really cool. And they had a total of almost 20,000 participants. That's huge, when you're talking about the end value. All right, how about probiotics? People are like, well, probiotics, I just hear about that shit for your gut. It's like anybody who's having problems with their gut, take probiotics. But it really, really helps with gastrointestinal health. But it also shows that having good bacteria may minimize UV-induced skin photo damage. So that's cool, right? And we talked about this on a podcast where your gut is continuous with your skin. It's all exposed to the outside world. It all comes from the same embryonic tissue too. And so making sure you have good gut bacteria, or maybe even using a probiotic. We even talked about on one podcast some formulations of topical probiotics, right? But these things really seem to lower the inflammation in your skin after being UV irradiated. Certain bugs like Bifidobacterium breve and Lactobacillus rhamnosus, these have immunostimulatory effects and they have a photoprotective effect. All right, how about tea polyphenols? Yeah, you can take these as a supplement, but why not just drink the tea? Green tea, EGCG, strong anti-inflammatory effects. There's topical formulations of this for skin. I think some sunscreens are starting to use these, but also doing it internally is a big deal, right? So you can drink this. I do give supplements of green tea also, but it reduces DNA damage, of course. It inhibits angiogenesis. This is how tumors kind of spread, and of course, it reduces inflammation. Good, neat animal studies on that. We certainly need human studies, but why not? I mean, this is in our culture to drink tea, and we have some good information here to use this stuff.
Mix a little stevia, put some ice in it, call it a sweet tea, and drink it in the sun. I've done that before. It feels great. And you're protecting yourself.
Yeah. I mean, tea is one of those things that kind of the research, it keeps on giving health benefits with the research.
Right.
Here's an herb that not many people know about. It's getting some good review in the literature. It's called Polypodium leucotomus. Specifically, it's a tropical fern with anti-inflammatory, antioxidant properties. It's long been used by Native Americans for treatment of various inflammatory disorders. And it's been studied as an adjunctive treatment for several skin cancers or skin conditions like atopic dermatitis, photodermatosis. Let's see, one study here showed, again, these aren't animal studies, but it just showed in mice that it lowered the activity of the COX-2 enzyme. So it didn't create a lot of inflammation, so it decreases inflammation. Also, there was evidence that it reduced DNA damage from the UV radiation. And then in 61 patients with melanoma, pre-treatment with this herb before exposure to UV radiation basically increased the minimal dose of UV radiation. So basically, if you take this stuff, you can be out in the sun longer, right, without causing damage.
So it's helpful to know if you're planning a beach trip and things like that, and kind of increasing it in your diet.
Well, so just to reiterate, all those high antioxidant foods, fruits and vegetables, they do the same thing.
Right.
They increase this what we call the minimal erythematous dose, which basically means that the more you eat of this stuff, the longer you stay out in the sun without getting burned.
Okay, so plan to look good on the beach and also stay on the beach for a little longer.
It's that internal sunscreen we're talking about. Healthy diet. I found this interesting. I found this there are fruits out there called blood oranges. I don't know, have you ever had one of those? Okay, so basically it's an orange. It tastes like an orange. Yeah, you're in Florida, right? Of course you've had those. But it's like a regular orange, but the meat of the fruit is bright red. And it's deeply pigmented with high amounts of bioactive compounds, anthocyanins, flavones, ascorbic acid, of course, vitamin C, and it has a this specifically has a potent antioxidant action. Anyway, these you can take these fruits in concentrated form in like a pill supplement form. I think it's called red orange complex, but it comes from these blood oranges, and it's been shown to certainly increase the or reduce the intensity of UVB on the skin, like that other herb, and doing your internal sunscreen. It's also been shown to help not only stop the likelihood of sunburn, but also to decrease your risk of cardiovascular stuff. Since it's red, it probably has lycopene in there also. So significant photoprotective effects.
Right.
Grapeseed extract, we talked about this a number of times. Same thing. It seems to have DNA protective effects. We talked about fish oil as like our natural aspirin, right? Decreasing inflammation, suppressing COX-2, keeping inflammation down. There are some others here that I won't really go into, but one that I do want to talk about, just because melanoma kind of has the same name. We've talked about supplementing with melatonin. Most people think about supplementing melatonin as a sleep aid.
It's been coming up recently quite a bit.
Right.
Episodes.
Right. but it's really coming up as a promising candidate for sun protection, and it's starting to be put in topical applications. So melatonin to protect your skin to help reduce melanoma.
Oh no, don't fall asleep on the beach.
Yeah. Yeah, that's right. Yeah, that's right. That may be the downside, right? Don't take too much of it. No, but it is interesting. So a lot of people think melatonin actually will cause you to go to sleep. It's not a great sleep aid. It just helps you, kind of get your circadian rhythm on track. So I always tell people I take melatonin, but it didn't really help me sleep. Well, it's not really supposed to do that. It can just, it's kind of gets you set up so that you could sleep better. So I usually combine melatonin with magnesium, and that works better.
Yeah, it's kind of like an enzyme, just get you towards healthier sleep.
Yeah, it gets you towards that. Vitamin D. This one's a huge one. It's kind of strange, right? The best way to get vitamin D is to be out in the sun. However, if you're very fair skinned, the best way to get vitamin D, and it will keep you from getting burned, is to supplement with it. And most of us, we spend our lives indoors, so it's a good time to supplement with that. And
yes,
most of us should. A good multivitamin will have a little bit in there. You really can't get a lot of vitamin D from food, so you really do need to supplement with it. It's just unfortunate. The same UVB, radiation that causes skin cancer also, and maybe this is just a built-in effect of the skin, also causes your body to make supplemental vitamin D. So that's why, like you doing your daily ritual 10 minutes outside may be really beneficial. Your body will make some significant amount of vitamin D with just 5 to 10 minutes of sun exposure, and you don't need to get burned.
Yeah.
Very powerful antioxidant resveratrol, another form of resveratrol called sterosilbene. They will reduce the pro-oxidant effects of cancer cells, thus keeping tumor genesis and metastasis down. These things are good things to take. Some of these things are being played with by putting in topical formulations. Curcumin, I think it's probably the best well-known anti-cancer nutraceutical out there. Quercetin, found very high in onions. The higher the intake of quercetin, the more it's been associated with decreases in risk of certain types of cancer, especially lung cancer and colorectal cancer. It seems to be high doses of quercetin seem to be toxic against melanoma cancer cells, especially in animal studies. Let's see. Oh, another one I want to talk, two more that I want to talk about. There's others out there, but we haven't really talked a lot about this. Maybe we should do a podcast on both these two supplements that I'm going to talk about next. But one is called modified citrus pectin. So again, citrus pectin, coming from the good state of Florida, all about citrus and pectin and oranges and things like that, lemons and stuff like that. But this is modified citrus pectin, and it comes from plants, herbs like that, fruits like that. But it is basically the peel and the pulp of citrus fruits. And basically what it does is I use it with my patients to help prevent the spread of cancer. If somebody has a diagnosis of cancer, I will give them this. And its activity against metastatic cancer is related to its ability to inhibit what's called a pro-carcinogenic factor called galectin-3, and galectin-3 is a binding protein that's produced a lot in cancer cells, excess in cancer cells. And basically this MCP, modified citrus pectin, will bind to these galactin-3 type molecules and keep the cancer from spreading. It's kind of the way the cancer signals to other cancer cells, let's spread and let's wreak havoc on the body. Modified citrus pectin can inhibit that. So it's one of those things that seems to be especially effective with melanoma, but I feel like it's a must with melanoma. People should take that along, and it's not going to inhibit any conventional treatment that they're doing. But I will generally use it with just about any type of cancer to just keep the spread at a minimum or keep it down. So modified citrus pectin. Another one that I use, unfortunately, it's expensive though, as far as supplements go. I think for like I don't know, a 30-day supply of fermented wheat germ extract. The kind of market name is Ave Mar or Ave Ultra, the brand name. Anyway, it's a fermented wheat germ extract, and it's been patented. There's quite a few studies on it, but for I think a month's supply, it's like $200. It's approved in Europe as a dietary food for special medical purposes for cancer patients. It combats cancer via several mechanisms, including the inhibition of glucose uptake in cancer cells. Metformin kind of does that. Suppression of metastasis, so it keeps the spread down. And it helps modulate the immune system in a appropriate anti-cancer way.
Okay.
So
wow.
lots of studies on that. So those two I want to talk about. There's other ones out there that let me just mention this one because I do use this a lot with integrative comprehensive cancer treatment. This one's called active hexose correlated compound. I know that's a complicated name, but basically it's basically a mushroom extract, and I use a lot of different mushroom extracts as immunomodulators and bolstering resistance to infections, keeping cancer spread down. It has lots of anti-tumor effects. So that's another one that I would use. All of these are very valuable adjunctive treatments that can usually be used in conjunction with any type of cancer treatment.
Okay. Awesome.
So, I mean, that's all I want to go through. I guess the main thing I want to just review is all skin cancers are highly treatable if you catch them in an appropriate time. For the less virulent cancers like squamous cell and basal cell, again, the earlier you catch it, the better. But that's especially true with melanoma. So the earlier you catch it, the better. The likelihood that it's not going to be a problem. If you catch it early, it's not an issue at all.
Okay. So there's definitely a lot of, I mean, one, it's external, which really seems like it would help just overall treatment and being able to assess it, find it, and treat it. Definitely makes a big difference in how easily treatable it is or not. But again, just kind of checking up on this regularly, being aware of your skin, monitoring things.
It's just really keeping your checkups good. It's like, to keep your car running well, you want to, rotate the tires every 7,000 miles, get the oil change, so on and so on. You really need to make sure that, especially the older you get, but really start now, is to, get your yearly annual checkups. I know a lot of people complain that a lot of doctors aren't doing in-depth physicals. And I'm just like telling them, well, you need to tell them to look at your skin. Definitely should do that.
Yeah, that's funny. I think that was the first thing I was thinking about. I don't think they really looked at my skin.
Yeah,
my physical, and we're in Florida.
And they should. Yeah, it's kind of crazy. The physical exams are becoming a lot more. I don't know, like protocol based, mechanical.
Yeah, they're standard of care.
Yeah, it's so
without the standard.
Right, right. But it is very important to ask people to look at your skin. I think that's one of the questions I always talk to my primary care doc about, or, my wife will look at it, and, just doing an assessment on stuff like that is so important and can definitely keep the suffering and misery down later on in life. And the older you get, the more important it is, because the older you get, the more likely you're going to develop some of these things.
Mm-hmm. Yeah. Anything else, Keoni?
No, I think that's it. Hopefully, people didn't fall asleep on that one.
166 is our sunburn prevention and sunburn aftercare episode. We obviously talk about a lot of things that relate to this episode. I think it's 58 or something like that, but it's called The Mighty Tomato. It's all about lycopene and the mighty tomato and all the benefits of tomato. But those would go great alongside this one.
Yeah.
if you're looking for more.
Absolutely.
Until next week, everybody, or until we talk to you again, be well.